This presentation is designed to give you further information about laser for brown spots and pigmentation. Your skin concerns are very unique to you, and achieving healthy skin for life involves a plan that's very specific to your needs. What does the sun and age do to our skin? As we age, we develop brown spots on the skin, and this is due to a combination of sun damage and natural aging. There are many different ways to go about treating skin pigmentation, and there are certain lesions that are responsive to different types of lasers. It's important to have experience and knowledge when advising patients about the treatment that's specific to their needs. This presentation is about pigment laser. However, certain types of pigmentation may require a different approach, such as Fraxel laser management. Pigment laser is a safe treatment. Generally, the face, chest, hands, arms and legs can be all managed in a single session with this treatment. There is minimal social downtime with pigment laser, meaning that you can go about your normal activities after treatment. This is an indication of some results of what this laser can achieve. This patient had a big pigmented lesion concerning her on her left cheek, and this was managed with one treatment. This was a harder to treat lesion requiring more than one treatment, and it has responded to the pigment laser, but the final amount of pigmentation left in this photograph will be managed with Fraxel laser. As you can see, a combined approach may be required to manage pigment spots. I find that the darker pigmented lesions respond well to pigment laser, but the lighter pigmented lesions may require Fraxel laser for management. This patient had some diffuse pigmentation that was bothering her, and she responded nicely to one treatment of pigment laser. She did not want the downtime required for Fraxel laser management and just wanted a simple approach. This is an expected result following treatment of the hands with some residual pinkness that resolves after about 2 weeks. My approach to treatment involves a consultation to assess your individual concerns and to examine your skin. We need to make sure that you have no skin cancers or melanoma prior to going ahead with any laser treatments. A professional treatment plan is developed that is tailored to your specific needs. Does it hurt? Most people do not find it extremely painful. The treatment takes 15 to 30 minutes depending on the area treated. No topical local is required, and cool air is delivered onto the skin prior to treatment. It feels warm and hot, and you may see a bright flash of light, but your eyes are protected during treatment. Pigment laser is very safe, and it has a proven safety record. Darker spots, as mentioned, will respond better than lighter spots to this treatment, and experience is required to advise you what will respond to treatment. As mentioned, there is minimal social downtime, and so you can go about your normal activities, unlike non-ablative fractionated laser. So today I'm performing a laser treatment for the management of pigmentation using the Gentle Max Pro laser. Generally, this laser requires minimal downtime. Around day for the face, it'll take around 7 days for the pigmented spots to crust off. Generally, I perform 2 to 3 treatments separated by approximately 3 to 4 weeks when I carry out this procedure. Generally, an annual treatment is recommended to sustain results. I can also use this laser to treat pigmentation on the hands, for instance. So I'm treating her pigmentation just gently. Do you find that uncomfortable, Katrina?
Not too bad.
So it's nice, straightforward, simple and effective technology for the management of simple pigmentation. The darker pigment spots do tend to take this laser up a little bit more effectively than the lighter pigmented spots. So what do you need to know before treatment? It's important to avoid excessive sun and fake tans for 4 weeks prior to treatment, cease all active topical creams, and advise me if you have a history of cold sores. Also advise me if you have any concerns or worries around the treatment. Females who are pregnant should not have this laser. After treatment, it's important to continue any cold sore treatment I have put you on prior to treatment if you have a history of cold sores. You may experience a heat sensation for 2 to 3 hours, which is more intense if you have a lot of pigmentation. You may develop some swelling, particularly puffiness around the eyes the next day following a treatment. Cold packs that are safely applied to the skin and sleeping on an extra pillow are advised. Crusting or darkening of the pigmentation can develop after treatment and may last on the face for up to a week to 10 days and on the arms, limbs and chest for up to 14 days. As mentioned, the chest and hands take longer to recover, but there is no need for social downtime following this treatment. It's important to avoid extended sun and UV exposure for 2 weeks following treatment. And to sustain results, maintenance treatment is recommended every 12 months. If you'd like any further information, please do not hesitate to contact me or ask my helpful team for advice.